The honourable member for Airdrie Cochrane.
Mr. Speaker, prior to COVID, many boasted about Canada having one of the greatest healthcare systems in the world. But when stress tested, capacity declined, and wait times increased. The system failed to adapt and meet expectations. Dedicated frontline staff did their utmost, working in a stressful environment, dealing with countless managers and supervisors in a bureaucracy resistant to change. Now our government put forward a number of great initiatives in this budget. $2.2 billion to build health facilities, $100 million to expand hospital capacity and ICU beds, $64 million towards EMS, and $23 million to Alberta's 911 system, to name a few. But a problem remains. Canada ranks second as the priciest universal healthcare system in the world, but among the bottom in performance. With Alberta being the most expensive in the country, and considering the failures at AHS over the last 2 years, it is clear higher levels of spending do not translate to better results. Budget 2022 calls for the addition of 850 new full-time positions at AHS, but under the same ineffective management, is this money well spent? AHS staff dissatisfaction is another factor. Without meaningful interaction with the front line to create a positive work environment, fundamental change will be difficult. Mr. Speaker, AHS is a bloated and underperforming entity that requires reform to ensure its future success. Professional consultation, restructuring management, and meaningful implementation of publicly funded, privately delivered services will help. One does not leave a struggling system to continue struggling. It's imperative that we have trust in our public institutions, trust in government, and trust in leadership to do the right thing. To satisfy trust and generate confidence, change becomes necessity. Thank you, Mr. Speaker.